have been to the forefront of managing the coronavirus outbreak here in Galvin Hospital, and we wanted to take some time out from our work to actually explain to you how our respiratory service has changed in the last few weeks and how we plan to manage it going forward.
As you might imagine, a lot of patients that are coming into hospital with any respiratory symptoms now, we are very much suspicious that they could have this COVID-19 virus. So what we're doing is that if we have any patients that come in that are suspicious for the virus, we're bringing them to a separate part of the hospital where they're being managed and investigated appropriately. There are some patients that may come in that are not suspicious for the COVID-19 virus, and if that's the case, then those patients are managed in a different part of the hospital. There has been a lot of work done looking at how to structure the hospital so that we don't have any potential to pass infection from the COVID area to the non-COVID area of the hospital. Certainly had lots of patients who have come into hospital with COVID-19, and we've had a lot of good success. So a lot of our patients don't necessarily present with very severe infection, and a lot of the patients, that even those that do present with severe infection, have done very well, and the majority of people come into hospital with this condition have been able to get home. And if they do go home, what we've been doing is we've been arranging for a follow-up of these patients. Traditionally, we would have brought people back to an outpatient clinic, or we may have had our community respiratory nurses calling out to see them. But what we're doing now is we're arranging a combination of telephone calls and, if necessary, some X-ray appointments a number of weeks down the line. So it is really down to the good work of the public that we actually have managed to cope very well so far with this pandemic. We were prepared to potentially deal with very large numbers of people. Thankfully, the numbers have been less than was expected, but we think that that is primarily down to the public being very good at self-isolation and being attentive to hygiene. So we'd like to actually take the opportunity to thank people for having done so well on that front.
The other thing we want to make sure is that if any patients are out there and they develop new respiratory symptoms such as for example, coughing up blood or have a new persistent cough, it's important that you do go to your GP. GPs are open, we're open to business. We have changed how we work our outpatients, but we're still seeing patients indirectly and still arranging scans, x-rays, camera tests, etc. So please, if you do have any new respiratory symptoms, go to your GP, and you will be seen in an area of the hospital that's not near the COVID wards, and that you will actually be have the regular tests carried out and referred on, and hopefully then we can manage your condition and improve as you go along. The other thing, apart from new patients, are our regular patients, and we want to just say hello to them. We do miss you, and we do know that you have been so good, and we've been in contact with you indirectly by phone. So basically, some of you have had phone calls from our doctors and some from the respiratory nurse specialists, and basically until we can go back to face-to-face clinics, that is how we're going to manage the service as we go along. The other group to remember are the community respiratory team, and they again are still open to business, and they're still waiting for you to ring if you've got any issues, and they will help you with treating your exacerbation, arranging antibiotics for your GP, etc. Michelle Doherty and Heather Coulter, the lung cancer nurse specialists, are still available and have been contacting patients. Anne Box, our NIV nurse, interstitial lung disease nurse, is still receiving calls, and the large number of our patients out there on CPAP with sleep apnea. If there are any issues with the machine, any queries, please, the contact here is still going to be Karen and Helena, and the same numbers you were given when you were first diagnosed. We've changed how we work, but we are here to manage our patients, both COVID and non-COVID, as we go forward.